not her real name, is rushed to the maternity unit of the 37 military hospital in labor. She's a National Health Insurance Scheme NHIS subscriber, meaning she did not have to pay for anything under the free maternal health care policy.
The free maternal health care covers maternal health services from pregnancy to delivery and through to postnatals. So when a woman is pregnant, she's covered.
But what turned up was a total cash and carry affair, as she paid for covered services before being provided the needed health care upon arrival at the hospital.
So the health insurance doesn't cover drug treatment?
Private health insurance. It covers when you go for consultation, but not to buy the drug.
It only covers consultation. Hey!
Ghana comes free.
Ghana comes free.
Nana and her husband, a farm worker, lacked the finances to pay for the bills, so every bill given to them was followed by phone calls to relatives and friends to beg for money. After spending over 3,000 Ghana cedis already on bills, the couple is hit with the tragic news. Their newborn could not survive. As if that is not enough, the grieving parents were then hit with another news of the body being detained till a 1,064 Ghana cedis 17 pesos being the cost of staying in the neonatal intensive care unit prior to the death is completely cleared before a death certificate and clearance would be issued for the release of the corpse.
Okay, so after paying it,
you bring the receipt, bring the one and pick one.
okay,
They will give you the deserts.
okay.
The NICU bill was not the end of their trauma. While they grieved their loss, they were again confronted with where to find the financial help to settle the NICU and mortuary bills. The compounded bad news left the couple numb. Mrs. Adokobia, Deputy Chief Executive Operations, National Health Insurance Authority, NHIA, described the situation as totally wrong and unlawful.
If the baby dies, they still submit. You submit your claim because the patient was attended to within a period. The patient was attended to within a period. So you have to submit the claims and we'll pay.
So the hospital shouldn't hold the body
That they are owing.
The family pays a bill.
That is not right. That is not right. That is not right. So if somebody is admitted to a ward and something happens or the patient couldn't make it, the facility is supposed to submit a claim for the period that the patient was there, the medication that was given, the diagnosis that was given, and the facility should submit a claim and National Health Insurance will pay. There shouldn't be any reason where a body will be held, that they have to come and pay before the body is released to the relative. It is not right.
Corruption Watch contacted the 37 military hospital for comments, but as at the time of filing this report, they had not granted an interview 6 weeks after submitting a request. Nane's case is just one of several ordeals pregnant women and their partners go through in our government hospitals despite being covered by NHIS. Corruption Watch investigator Francisca Enchil goes undercover to expose the agony of pregnant women in hospitals, a spectacle of pregnant women being confronted with the option of paying cash before accessing the otherwise free healthcare under the free maternal healthcare policy, or refuse to pay and die. Corruption Watch uncovered this pay or die phenomenon in investigations conducted at the 37 military hospital, Mamprobi Hospital, popularly known as Mamprobi Polyclinic, and Mamobi General Hospital, popularly known as Mamobi Polyclinic. The investigation found gross abuse of the purpose for the introduction of the free maternal health care policy. It was found that health facilities have set their own rules to allegedly extort money from pregnant women during antenatal, delivery, and postnatal care. Some of these illegal payments that put unnecessary impediments on access to maternal health care have somehow been made official. Hence, pregnant women are directed to make payments at the bank. The investigation also found that health workers charge and directly take payments without issuing receipts for charges which are supposed to be free.
Health insurance card now you can health insurance.
Our investigation established that free maternal health care is currently only on paper, but practically it is non-existent in all the facilities captured in this investigation, although hospitals made claims for services rendered under free maternal health care, and those claims are paid for by NHIS. Although the NHIS policy pays higher claims to the referral hospitals than those paid to the polyclinics and general hospitals, it was established that at the referral hospitals, pregnant women are unlawfully charged higher amounts for the same services provided by the polyclinics. Dr. Chris Opoku-Fofie, head of Safe Motherhood Program at the Family Health Division of the GHS, said all health facilities under the GHS run scans for free.
Within the service facilities, we have the health insurance tariffs that have been established, so all such ones are classified and are billed accordingly. Because we have what we call the bundle service, so where the facility doesn't have an ultrasound, they usually have some arrangement, partnership agreement with private facilities within their catchment area. So they refer the ultrasound scans to them, they do the ultrasound, and they are billed accordingly. So their health insurance numbers are documented, and after that they present the claims to the National Health Insurance Authority and they are paid. It's not supposed to be cash and carry. It's part of the service.
However, this investigation established a contrary fact. Many pregnant women were unaware of their entitlement under the FMHC policy. It also found that even when pregnant women who were aware of their entitlement put it to health workers and demand same, they denied it flatly that antenatal services are free. At the 37 military hospital, pregnant women are denied their benefit of free scan. A scan cost 100 Ghana cedis at this facility.
Please.
I didn't know which kind of this. Yeah.
Pregnancy.
It's anything. But this is we book. You have to come and do it today.
They'll give you appointment.
Oh, okay.
Yes.
It's 100 cedis.
Yes.
Wow. Would the health insurance cover the scan for me?
Premium. You have private premium.
No, I use the national health insurance.
No, then you pay. National insurance you pay. Apart from private insurance. Private insurance you pay.
Okay.
It was discovered that the list of laboratory tests given to pregnant women cost 250 Ghana cedis at the 37 military hospital. Other tests like full blood count cost 35 cedis.
Actually, 185 Ghana cedis. 185 cedis.
Got the health insurance.
I'm not there, sir.
Hey, Ntanga, erasing.
Why specialized test to chemistry and violence?
Corruption Watch contacted the 37 military hospital for comments, but as at the time of filing this report, they had not granted an interview 6 weeks after submitting a request. Pregnant women who develop complications during the course of pregnancy at the 37 military hospital are made to pay for every drug, lab test, and scans on a cash and carry basis. What is more, if the pregnant women are detained for further medical observation, they are charged 60 Ghana cedis as admission fee for each day spent under medical observation. Despite having paid for every service already, during discharge, the bill is above 1,000 Ghana cedis and can increase depending on the number of days spent on admission. The delivery day is the most anxious in the 9-month journey of a pregnant woman. Not every pregnant woman that enters the delivery room is lucky to make it alive. Not every baby makes it out alive, and not every baby who is born safely survives the first few days. Hence, the moment labor starts, it is all prayer for families for the safety of mother and child. This stage is, however, a bumper revenue collection day for health facilities as they issue killer bills with no empathy. Partners, or sometimes friends and family, are traumatized with the guilt of failing to make timely payments for drugs and tests. Women who are not able to pay their bills are detained until the amount is raised by their family or a philanthropist. Delivery at the 37 military hospital makes no room for the poor. The maternity unit of this hospital is run like a private health facility with comparatively very high charges. Every single medication, materials, or service needed for delivery is purchased by patients and their families on a cash and carry basis. It was also found that despite having a pharmacy inside the maternity unit where medicine could be dispensed when needed, pregnant women are asked to buy medical supplies even when its need is not yet required, sometimes leading to some women returning home with unused medical supplies like infusion when they are discharged from the hospital. Despite being made to buy everything and pay for every service in a cash and carry manner, the medical bill issued to patients during discharge is very high, with the lowest being above 1,000 Ghana cedis. Although the FMHC policy requires hospitals to submit all bills as claims to the NHIS without billing the patient any amount directly, 37 military hospital does the contrary. They bill pregnant women for even admission and consultation at the maternity unit. Meanwhile, poor people referred to this hospital visit the facility hoping to depend on their FMHC entitlements. According to the FMHC policy, NHIS covers the bill 100%, hence does not cover part for pregnant women to pay for the other half. However, 37 military hospital practices the contrary. The bill they issue claims NHIS only covers a portion and the patient pays the rest. 37 military hospital issues bills ranging from 800 Ghana cedis to 1,000 Ghana cedis for women who have spontaneous vaginal delivery. This amount goes higher depending on the number of days the patient spends on admission, as 60 Ghana cedis is added automatically each day as admission fee. Out of this amount, the hospital's bill states that NHIS covers 159 Ghana cedis 70 pesos and the patient pays the rest. NHIS described this as unlawful.
Spontaneous vaginal delivery, where the woman delivers on her own, naturally, it is covered, fully covered. When the woman is assisted to deliver, that is either cesarean section or vacuum extraction, that one too is covered.
37 military hospital charges between 2,000 Ghana cedis and 5,000 Ghana cedis for cesarean section. The longer you stay under medical observation, the higher the bill. According to information on the bill issued at the hospital, NHIS covers only 543 Ghana cedis 20 pesos of the total bill. The periodic postnatal care, commonly referred to as weighing, is relatively completely free at the 37 military hospital. However, neonatal intensive care unit NICU service is not free. At the 37 military hospital, newborns are charged a daily admission fee of 50 Ghana cedis. The number of days spent in the NICU determines the magnitude of the bill given to parents. At the 37 military hospital, babies who spend up to 3 days in the NICU are billed 1,064 Ghana cedis 17 pesos. According to the information on the bill of the hospital, NHIS covers 565 Ghana cedis 74 pesos of the total cost, while the family pays the rest. This amount has an automatic 50 Ghana cedis increment for each additional day spent at the NICU.
We have tariffs that covers babies that are sick. So that's one to when a baby is admitted at NICU, we have tariff for it. It is covered and they shouldn't be allowed to pay. When a baby is admitted, the baby or the mother shouldn't be allowed to pay because that one too is covered. When a baby is admitted at NICU, it is covered under the benefit package. Completely.
And the medication?
The medication is covered. The medication is covered.
We continue this investigation at the Mamprobi Hospital. This was the only hospital amongst those we investigated that required pregnant women to spend up to 96 Ghana cedis even before being accepted to register for antenatal service. As part of the registration expenses, nurses at the Mamprobi Hospital were also found directing pregnant women on their first visit to their welfare shop to purchase a mandatory package. This mandatory package contained some items needed only on the delivery day, but pregnant women were made to buy them at 26 Ghana cedis even before being registered and given their maternal health record book to begin antenatal. This package is given to the welfare shop by the nurses to be sold to pregnant women.
What's going to happen?
I see list the underpart.
List the underpart. They didn't say anything, they just said we should come here, so at least said we deserve to know exactly what we're coming to.
They are supposed to tell you everything that they are supposed to buy. Because me they selling, they bring the things for me to sell. What you are saying. So they should explain to them, say, oh, who the talk? Say.
Dr. Charlotte Cato, specialist in charge of Mamprobi Hospital, denied that the facility makes any demand before allowing pregnant women to access antenatal care. However, Corruption Watch's investigation found this claim by Dr. Cato to be false.
So if you don't have the insurance and you go and do the insurance, yes. But once you are pregnancy is confirmed, you start your own.
The pregnant woman is not required to have any, there's no list of items to apply before you be able to start acting.
The Mamprobi Hospital officially charges pregnant women 35 Ghana cedis for a scan. This payment is made as many times as a scan is required. One other financially draining unique policy of the facility was that scans done in facilities outside the Mamprobi Hospital were not accepted by the health workers. Pregnant women who run scans before visiting the facility to avoid the queue are made to pay for a new scan, even if the first scan done outside was done the same day.
I don't think we have any problem with the scan. We don't have a problem.
Despite establishing that Mamprobi Hospital charges NHIS holders 35 Ghana cedis for scan, Dr. Charlotte Cato denied the charges. According to her, the facility only charged pregnant women who do not have NHIS cover 30 Ghana cedis, but it is at no cost for NHIS subscribers.
So antenatal care, which is consultation, is free. Then drugs completely free. Scan is free. Lab free. And delivery is free.
Yes.
They are all free.
And the NHIS. Once you have NHIS, yes.
At the Mamprobi Hospital, pregnant women are denied access to free laboratory tests as well. The first group tests are divided into two. First half cost each pregnant woman 30 Ghana cedis. The other half of the test cost 20 Ghana cedis for NHIS holders. Meanwhile, all these tests are covered under the FMHC policy.
Insurance guy, no, or almost they don't have the cover, and they don't have the cover.
Yeah, we have insurance in cover 30.
Two different types.
We a scan, and then we a lab 30.
I pay for the 30 cities. Okay. And in fact, scan,
corner scan for Bailey was scan. Now I could just scan. Now I could chow scan. Now I made that.
Health insurance cover.
Health insurance cover. So the only bar price in the low. The only bar price in 20 cities. So we have insurance in the 20 cities. 20 cities. What about my cities?
100. Wow. Oh, okay. So with the health insurance, no place. Okay. I'll show you that.
According to the head of the hospital, Dr. Charlotte Cato, these tests are covered by NHIS in her facility, so pregnant women enjoy them for free. But Corruption Watch independent investigation established that the hospital charges for these tests. At this facility, antenatal drugs are free. The drugs are actually already packaged with the station staff right at the antenatal unit dispersing them. Vitamin C was, however, paid for. We end this investigation at the Mamprobi General Hospital. Pregnant women were charged 10 Ghana cedis at the consultation room on a first visit. This, the nurses claimed, covers service delivery and some medical supplies. At this facility, pregnant women were officially charged 40 Ghana cedis for a scan. This amount is paid as many times as a scan is required.
We are labs. We are lab. We are scan.
Okay, but just scan is 40 cedis.
Adam Dachomo, principal nursing officer at the Mamprobi General Hospital, who refused to grant a video or audio interview, said scans were not part of the FMHC entitlement in their hospital. Mrs. Vivian Adokobia Deputy Chief Executive Operations at NHIA said NHIA pays for scans through the claims.
In the operation manual, it states that when you go for ultrasound scan, 2 is covered. You understand? 2 is covered. During the first trimester, you can go for scan. During the last trimester, you can go for scan. But in between, if there's any indication, that one too is covered. Okay, so if it's medically requested. If it is medically requested, it is covered.
Dr. Chris Fofie said that facilities are operating according to the rules governing the FMHC policy by offering pregnant women a completely free laboratory service.
Blood group.
Yes.
Is it also covered?
Yes, all that is covered by health insurance, yeah. GCSPD.
Oh, okay.
Hepatitis B. Yes, it's all covered.
However, this investigation established that laboratory tests are not free for pregnant women in any of the facilities investigated. At the Mamobi General Hospital, the first main laboratory test costs 50 Ghana cedis. Other tests done in the course of the pregnancy were equally not free. During another test at this hospital, the laboratory technician took the request form, samples for the test, charged 35 Ghana cedis, and received payments directly from the pregnant woman inside the lab without issuing a receipt.
35. I don't have change.
Edem Dachomo, the principal nursing officer on behalf of the facility, said the amount paid by NHIS as antenatal cover per visit is not enough to cover laboratory tests, although their supervising institution, GHS, supports NHIA's insistence that the service is free. She, however, said the hospital does not permit the collection of direct payments by staff for any service delivered apart from the bank. Hence, any staff caught doing that will be taken through disciplinary process for punitive action to be applied. At this hospital, the drugs that are available are paid for, and pregnant women are referred to buy the rest from private pharmacies on the grounds of unavailability.
National health forms.
Drugs, scans, and lab tests during delivery, including blood, is paid for on a cash and carry basis.
First, I know, but there can be 50. Big fair health insurance. They will then cover. That's basic.
Also part of the charges for delivery by CS were ward fee, CS procedure, suture, discharge, among others, costing 1,200 Ghana cedis as official charges of the hospital, aside extra costs incurred from drugs and tests requested by the hospital, which are run in private facilities outside the hospital. NHIS described this as unlawful and unfair as well.
When something happens or you need to maybe augment the labor, put in infusion for one or the other is an intervention. So if you want to set up a line, it is covered. It is in there. We pay for infusion during delivery. Everything is covered. Everything. As I stated, indicated, apart from the exclusion list, every condition, if you look at if you have listened to most of our presentations, 95% of the disease burden in the country is covered. So apart from those that are listed here as exclusion list, all conditions are covered. So there shouldn't be any reason why a pregnant woman should be allowed to pay. It is not right. It is not right. Wow. It is not right. It is not right. It is not right. All the medicines that are given during delivery, after delivery, and even postnatal, suppository is covered. Paracetamol suppository, diclofenac suppository, they are all covered under the benefit package.
Mamobi General Hospital offers NICU services to newborns. Although this service is supposed to be free, the service is not enjoyed for free. At the Mamobi General Hospital, NHIS-covered pregnant women are required to make payment of 200 Ghana cedis or more as NICU deposit. Aside this, drugs, lab tests and RBS tests are all run on a cash and carry basis. NICU expenses alone can cost a parent over 500 Ghana cedis at the Mamobi General Hospital. Mrs. Vivian Adokobia said facility heads claiming ignorance about the benefit are not being sincere.
You see, when we are revising or reviewing the medicines list, we have the stakeholders there. So we just project what is we project the medicines list. Then everybody, all those who are invited to the room, they will make input. No, this one is far lower, this one is higher, this one is... So, I mean, we dialogue with them. So we have their input before the medicines list come out. So that is how it is done. We have never single-handedly come out with prices or what we can pay or what we cannot pay. We have never done that.
Pregnant women are expected to budget up to 500 Ghana cedis for antenatal expenses in normal pregnancy and about 2,000 Ghana cedis or more for antenatal expenses during pregnancy complications. Mrs. Vivian Adokobia described these as barriers that prevent the poor from accessing antenatal care, defeating the purpose for which the policy was introduced.
It is supposed to take out the financial stress or financial burden on the Ghanaian women. It is also supposed to encourage people to attend facilities so we can reduce maternal mortality in the country.
According to Mrs. Adokobia, all laboratory tests required in the course of pregnancy are all fully covered by NHIS. Hence, pregnant women should not pay any amount of money for that service.
Every single lab test required, from the CHIPS compound through to primary care, through to primary hospitals, through to secondary hospital, to even tertiary hospital, it is covered. We have the benefit package for diagnostic services, and they are all indicated with how much each of these diagnostic investigation costs stated. So the pregnant women are not supposed to pay anything. If you look at the law, we have exclusion list. So apart from those that are stated as part of the exclusion list, everything is covered.
SDG Goal 3.1 targets the reduction of the global maternal mortality ratio to less than 70 per 100,000 live births by 2030. It further aims to end preventable deaths of newborns and children under 5 years of age, with all countries aiming to reduce neonatal mortality to at least as low as 12 per 1,000 live births and under 5 mortalities to at least as low as 25 per 1,000 live births. According to the 2019 UN Interagency Group for Child Mortality Estimation, the infant mortality rate of Ghana is 34 deaths per 1,000 live births, and Ghana's maternal mortality rate is currently 308 per 100,000 live births, according to GHS. Although the infant and maternal mortality rate has been declining since the introduction of the free maternal health care policy, the margin of decline hasn't been different from the margin of decline in the years before the introduction of the policy. For Ghana to meet the SDG Goal 3 target, The policy formulators, as well as those at the point of service delivery, must ensure that the free maternal health care policy is made to work fully to remove barriers and expand access to maternal health care. Francisca Angel's report. Watch out for part 2 in our next edition for more shocking expose in other hospitals.
I must say, this is very heartbreaking to find out that this is what is happening. Thank you very much to the investigative team for putting this documentary together. All we can aspire and hope for is a better, society, a better condition of service, or a better, healthcare systems and structures, especially for our women. Like I keep saying, at the end of the day, we all came from women. So in my own words, I think this has to be prioritized, and we must take a critical look at this. Thanks one more time to the team that put this documentary together to expose the corruption and the rot in our healthcare system. Part 2, bringing you a video live right here on our platform on Pay or Die, a documentary that captures the very worrying or growing cancer in our maternity wards, especially what women go through when they have to deliver. You might want to watch this one. Don't go away.
Is losing so much blood right after having a vaginal delivery. There is a medication to save her. The hospital has it, but she will not receive this life-saving medication if her husband doesn't raise the money to pay for it.
Thank you.
This is in spite of the existence of the free maternal health care policy that declares the entire 9-month journey completely free. Francisca Angel takes you undercover to expose the agony of pregnant women in hospitals, a pay or die phenomenon at the Kolebu Teaching Hospital, Kaneshi Polyclinic, and the Gan West Municipal Hospital, popularly known as the Amasaman Hospital. This is a part 2 of similar findings at the 37 Military Hospital, Mamobi General Hospital, and the Mamprombi Hospital.
15 cities na modem. What's the register insurance no certain so 5 cities. I'm going to register insurance. I'm going to register insurance no so 5 cities na de. This got that ahia kita me 7 ya ka 2 cities. Because say am na me free na send me dey me papa. Hey.
This is the reality of financial struggle of the poor referred from the various health facilities to the premier hospital in Ghana. We begin this undercover work at the Kolebu Teaching Hospital to capture live this victim's ordeal as it unfolds. The premier referral hospital averagely records 5 infant and maternal mortalities in a month.
How many infant and maternal mortality do you record averagely in every year?
2 for the mothers. Babies, yes, about 10 or 20 in a month.
What do you think that could be contributing to this high number of mortality in infants and mothers?
Sometimes not accessing antenatal care early, or yes, even sometimes when they are referred, they stay behind till in the critical stage before they come. So, not accessing antenatal care early. Have you never heard of women saying, "Minisika medibeko"? They do.
Antenatal.
Yes, sometimes they do. Sometimes they will tell you maybe the husband is not giving the funds to go to the hospital, or the partner, or they even start the antenatal care, but along the line, if they don't have the finances, they decide to stay behind.
In spite of this, the hospital and its staff have placed barriers in the way of access to maternal health care. Pregnant women do not enjoy the free maternal health care policy in the Premier Hospital.
We can say that antenatal health care is quite expensive, particularly here in Kolimo.
Not if you have the health insurance, at least it helps.
So over here, if somebody has the national health insurance, what would the person benefit?
It covers all the services that she's giving here,
including scan, labs.
It doesn't cover scan. Some of the labs it covers.
Here, antenatal care is given at two different units of the hospital, the Gynae OPD and the maternity unit. The Gynae OPD only accepts pregnancies below 12 weeks, and the maternity unit accepts pregnancies that are 12 weeks and above. It was found during this investigation that NHIS card-bearing pregnant women were required to pay 105 Ghana cedis 20 pesos for a folder at the Gynae OPD to begin antenatal, and pay 17 Ghana cedis on each antenatal visit till after the 12 weeks, where they moved to the maternity unit.
Yes, they said we should come tomorrow, so I just wanted to know how much it would cost. 105 20 pesos with health insurance.
First time health insurance will not cover, but the subsequent
visits. Oh, okay. Thank you. The subsequent visits, 70 per visit.
At the maternity unit, pregnant women pay some official and unofficial charges. The unit officially demands payment of some 5 Ghana cedis. You are not told what exactly you are paying for, but every single woman attending antenatal is made to pay this amount on each visit. You are directed to pay at the bank and submit the receipt as proof to the nurse before you can enter the consultation room for your antenatal care. This payment is classified as antenatal maintenance fee on the receipt. Also captured was the demand for some payments by health workers directly to themselves without issuing receipts. These payments included 5 Ghana cedis as cost of covering the maternal health record book with a rubber. As well as the demand for the payment of 15 Ghana cedis at the counseling room after HIV, AIDS, HB and sugar tests.
Hello. Counseling room.
Yeah.
What's also near payments?
HIV fit, HB sugar, HIV fit free, HB sugar, no better 15.
Oh, okay.
In a follow-up interview with Corruption Watch, the Chief Nursing Officer of the Department of Obstetrics and Gynecology at the Kolebu Teaching Hospital, Mary Anderishon, she acknowledged officially charging the antenatal maintenance fee, but said it was a management decision.
Pay only 5 cedis if you have the national health insurance. If you don't have, pay 20 cedis. So at least you are helped some way.
But that 5 cedis, what does it cover?
The 5 cedis I'll say is for maybe processing the papers and things. That's what they pay for.
And they pay.
We do it, yes.
This hospital, the free maternal health care policy isn't working.
Like I started by saying, here is a tertiary institution. So before they put in any measure, they seek approval from the central government.
She, however, denied knowledge of the 5 Ghana cedis unofficial charge by the nurses.
We notice that pregnant women are being given some rubber to cover the book at a cost. Are you aware of that?
That's why I'm not aware, because we are not supposed to take any monies from any patient.
And the 15 Ghana cedis taken in the counseling room. According to her, all tests conducted at the counseling room are fully covered by the NHIS.
HIV is free. HIV syphilis is done freely.
Okay.
For all pregnant women.
What about the HB?
The hemoglobin level, it's covered by the National Health Insurance. So if the patient has, fine. She needed to pay.
Oh, okay.
Yes.
At the Kolebu Teaching Hospital, we were charged 70 Ghana cedis for an ultrasound scan. At the central lab of the Kolebu Teaching Hospital, pregnant women covered by the NHIS are charged up to 142 Ghana cedis as cost of running the list of laboratory tests.
Maternity. Right. Insurance will cover for 1, 2, 3. So this, and that. So you
covers which one?
Malaria, sickling, and then routine RE. It's 2 RE.
So which one are we paying for?
We pay for this.
What's that? Which one is it? What does it?
This one is just speed.
What's that?
Blood group. When you go to blood bank, you do the thing. Then you have the antigen. This one is 31 cedis.
What's that?
Hepatitis B antigen. This one is urine RE.
Urine RE.
49 is Jesus P. HBS.
That's hepatitis B, right?
Yeah.
That one is how much?
31.
31.
Urine RE. 27.
So this money, the blood group is not part.
The blood group had like 30 cities, around 30 cities. I know it's around that. Wow. Blood bank is here. In front of this story, the 2-story building in front of.
Yeah, we'll find out the price. Then we put the rest here, all of them. Blood group. Okay, I have pregnant? What time? Thank you. And are you already down with 35 cities? What was the thing? Oh, but we have insurance. Insurance doesn't work here. It doesn't work here. Wow. That's like insurance.
According to Mary and Dershan, all those charges are management approved, and those approvals have the backing of the Ministry of Health. The magnitude of unlawful charges for delivery varied depending on how normal or complicated the delivery was, which informs what goes into the delivery. At the Kolebu Teaching Hospital, pregnant women with NHIS cover are charged 400 Ghana cedis and above for spontaneous vaginal delivery, while delivery by CS cost 1,500 Ghana cedis and above for NHIS holders. The premier hospitals appeared to have some similar practices, like a strange phenomenon of NHIS not covering any drug in the pharmacy of the maternity unit. The difference, though, is at Kolebu Teaching Hospital, important drugs are administered on the pregnant woman when it is needed, and she is then billed to pay for the drugs during discharge. The hospital, however, gives prescriptions to escorts of pregnant women to make some other purchases elsewhere. Aside the drugs, lab tests and scans are paid for on a cash and carry basis. This investigation established that the Kolebu Teaching Hospital renders neonatal intensive care unit NICU services. NHIS holders are charged for the care. Every NHIS covered woman whose newborn is admitted at the NICU of Kolebu is charged a fixed amount of 410 Ghana cedis and 20 Ghana cedis for wipes. Despite having paid the fixed charge, lab tests and drugs are paid for on a cash and carry basis by the parents. Mrs. Adokobia said the practice is not right.
During delivery, everything is covered.
We continued this investigation at the Ga West Municipal Hospital. Staff of this hospital exploit the vulnerability of pregnant women and their desperate families. They see delivery as profit-making opportunity, cashing in on the poor and vulnerable with strange and insensitive charges like other income. At the Ga West Municipal Hospital, popularly called the Amasaman Hospital, a scan costs 30 Ghana cedis. Dr. Eric Sapon Tiamwa, the head of the Ga West Municipal Hospital, said scans requested by pregnant women are not covered by NHIS in his facility, but scans medically requested are covered.
To have a scan done, it costs 25 cedis.
25 cedis?
Yes.
Is it supposed to be free or that's the...
It depends. Per the National Health Insurance package, the first scan that you do, because that time it has not been confirmed that you are pregnant, it's not done for free, you pay. Yes, so it's confirmed that you are pregnant, you're entitled to another scan which we also do for free. If you come in voluntarily, we'll explain to you and then you do it at a cost. Some people come, I want to know the sex of my baby. This is not NHIA approved. So if you come in with such a request, you will pay.
The staff at the scan room stated clearly that NHIS is not accepted in her unit. At this hospital, pregnant women are denied free laboratory tests. The group of lab tests requested at the beginning of antenatal, which are supposed to be free under the NHIS, cost 60 Ghana cedis at this facility. All other subsequent labs are equally not free. Dr. Sapon Tiamwa said NHIS does not cover all required laboratory tests. Hence, those covered are given for free, while the others cost 30 Ghana cedis.
The NHIS has bundled the services. We are on the bundled services, and routinely there are 8 labs that a pregnant woman needs to do. 8 tests. Some of the tests are covered by NHIS. I should say the majority of the tests are covered by NHIS. Some are not covered. HB, it is covered. So if HB is requested, it is covered. For the full blood count, it is not covered. It's not part of the bundle. A test like hepatitis B, which is also a very key requirement. It's an infectious disease. The mother may pass it on to the child. It's a key requirement. It's not on the bundle. G6PD is not on the bundle. So we give the bundled ones for free, and the ones that are not part of the bundle, you pay a small token for it.
Like how much, please?
So, for instance, G6PD, hepatitis B, and then full blood count, the FBC, we take a token of 30 cedis.
Dr. Chris Opoku-Fofie, head of Safe Motherhood Program at the Family Division of the Ghana Health Service GHS, states that the GHS is actively working according to the free maternal health care policy, which is binding on these health facilities.
The position of the service is that all that is illegal and should not be condoned. We are promoting access under the universal health coverage, and we want as many of our women to access antenatal care. So once you say you are pregnant, the doors are open for you. So anything that is done as a barrier to put a hindrance in the way of our pregnant women is unacceptable, and we don't really sanction that.
This hospital also makes available the drugs at the antenatal unit. These drugs are given for free. Some drugs are also paid for. At the Ganwest Municipal Hospital, despite the facility officially claiming that both spontaneous vaginal delivery and cesarean section are free, this investigation established that delivery is not free in this hospital.
It's your own receipt.
Our word fund, the word fund, how you cheer, and you need receipt. One, we don't let him massive. Two, nationality and your one and you. Then you're coming into any word fund, you're doing none of your child, and you need no receipt for home.
And don't do receipt.
You need no receipt.
Okay, Matthew.
It's the last year of the last year, and then you become myself. And then you know, the hospital, trauma. One part of our day. When you work from you have the seat. And then you work from you have the work. And you have the seat. And you are not going to be a client to Diana. I don't say for the seat. I do not pay the seat. Not trauma. One part of our day. You need to go. Now I work from you doing this. You have the seat. When trauma, and I said,
bring back all the seats. And
I'm 15 by a war farm, my academy for
Pregnant women are required to budget for more than 500 Ghana cedis to take care of the cost of delivery, drugs, lab tests, charges like assessment, other income, discharge and ward fund, among others. The most critical health needs are paid on a cash and carry basis. We concluded the investigation of the 6 health facilities at the Kaneshi Polyclinic. This facility officially charges pregnant women 35 Ghana cedis for ultrasound scans. This amount is paid each time a scan is medically required.
Consulting one, which is now I'm going to outside. Okay. After that, I have health insurance.
Please.
It's the same price.
With the health insurance.
The medical director of the facility, Dr. Stella Jamfi, admitted charging for scans, but she said she was not aware that scans were part of the free maternal health care entitlement.
We, with the scheme, we've had conversation with the scheme, and they did not tell us that free scan was part of the package. So they've been paying.
Mrs. Vivian Adokobia, Deputy Chief Executive Operations at NHIA, disagreed with the claim, adding that there was no justification for claiming lack of awareness.
About 90% of their IGF is from the National Health Insurance. So most of them, they take interest, so they know what the benefit package entails. You'll be given the operation manuals, you'll be given the medicines list, you'll be given the claims, the tariffs you'll be given. So I don't see any reason or justification for somebody to say that I'm not aware.
Dr. Chris Fofie, GHS, details laboratory tests required during pregnancy and the NHIS entitlement.
The full blood count, fasting blood sugar, GCSPD.
Which of them is covered by the National Health Insurance and which of them is not?
All the tests are covered by health insurance.
All the tests?
All the tests, the basic ones. The ones that are not covered by health insurance are specialized tests like genetic test.
HB test is covered?
It's covered by health insurance, yes.
The sugar level?
Yes, all that.
It's covered?
Yes.
Routine exams, is it urine?
Yes.
It's also covered?
Yeah, it's also covered.
The routine exams too?
Yeah, the stool Larry is also covered.
It's also covered by health insurance?
Yes. Hepatitis B.
Is it covered?
Yes, it's all covered.
At the laboratory of the Kanishi Polyclinic, the staff frequently announced that some of the compulsory tests pregnant women are required to undertake are not covered by NHIS. Hence, all pregnant women are required to pay 40 Ghana cedis for the tests not covered. Dr. Stella Jamfi disclosed that all lab tests are conducted for free for pregnant women as required by the policy.
Fasting blood, they do fasting blood sugar, they do VDRL, they do urinary, they do stool RV, they do blood group, they do sickling, they do GCSPD on NHIS, and they don't pay a dime. So NHIS have approached that several times to clarify with us about lab.
Okay.
So the lab are done free.
Since when?
Since I came here, at least. Since I came here, and then the lab in charge also was transferred in a few months after I came here.
Okay.
Yes.
It's completely free?
Yes.
However, the head laboratory technician, Ebenezer Nku, responded to the contrary. His response confirmed the findings of these investigations, which is the payment of 40 Ghana cedis.
In charge made us aware that since 3 years ago, the lab test for pregnant women has been completely free. Is that so?
Yeah.
Completely?
Completely. Unless other tests that health insurance does not cover.
The list of tests given to the pregnant women by the midwives, are there any of them that are not covered by the National Health Insurance?
Yes, hepatitis B. That one they pay 10 cedi for.
Which other one?
And then they pay for full blood count.
Okay.
The rest are free. They are covered under the health insurance.
The pharmacy of Kanishi Polyclinic makes claims of non-availability of drugs covered under the free maternal health care policy. Drugs that pregnant women are made to pay for are, however, always available. They refuse pregnant women drugs like folic acid, a drug used to treat or prevent folate deficiency anemia, help unborn baby's brain, skull and spinal cord develop properly, to avoid development problems, birth defects, and miscarriage.
The first one, second one, it doesn't come. We don't have the first one, the second one, it doesn't come. The first one is coming. The first one is finished. The second one we have, but it doesn't come.
How much is that?
13.
Although the pharmacist claimed folic acid was not available, the medical superintendent disclosed during an interview that the facility had enough folic acid in stock from September 2019 till date, an indication that at the time of our investigation, the facility had folic acid, but the pharmacy failed to give them out to pregnant women.
All the pharmacists had talked and asked him which one of the hematinics for the pregnant women were available, because I was told because the framework issue some of them. Then he gave me this. That from 2020 to date, Fesolate has been available at the pharmacy. From September 2019 to date, folic acid has been available at the pharmacy. And then Multivite 2 has been available from, it has never even run out to date. Right? So they have been there.
What we encourage mothers or subscribers, what we encourage them to do is that they should insist that if you are charging me for this, I need a receipt.
In that case, what should she use the receipt for?
We have you should report to us. We have the numbers that you can call, and we have people who receive the call, then they will follow up, or you can also follow up. We have recovered some monies and given back to people. We have recovered monies and given back to people. They are not supposed to be charging. It is a worrisome situation. So I think we all have to come together and fight this. It is not right.
The policy we inherited was cynically described as cash and carry. That is, if you are not well, you go to hospital and don't have money. Even if you are lucky to get a doctor that would examine you and prescribe, it would be just a sheet of paper given to you, signed by him. Go and find the medicine. You can't buy it, you go and die. The cash and carry. And we said no, that shouldn't be the thing for the people. So we really worked to introduce the National Health Insurance Scheme. Along the way, we also added the free maternity care.
SDG Goal 3.1 targets the reduction of the global maternal mortality ratio to less than 70 per 100,000 live births by 2030. It further aims to end preventable deaths of newborns and children under 5 years of age, with all countries aiming to reduce neonatal mortality to at least as low as 12 per 1,000 live births and under 5 mortalities to at least as low as 25 per 1,000 live births. According to the 2019 UN Interagency Group for Child Mortality Estimation, UNICEF, WHO, World Bank, UN DESA Population Division, the infant mortality rate of Ghana is 34 deaths per 1,000 live births, and Ghana's maternal mortality rate is currently 308 per 100,000 live births, according to the GHS. Although the infant and maternal mortality rate has been declining since the introduction of the free maternal healthcare policy, the margin of decline hasn't been different from the margin of decline in the years before the introduction of the policy. For Ghana to meet the SDG Goal 3 target, the policy formulators as well as those at the point of service delivery must ensure that the free maternal healthcare policy is made to work fully to remove barriers and expand access to maternal health care. Francisca Angel's report.